Vital signs are the most frequent and routine measurements obtained by healthcare providers. These include temperature, pulse, blood pressure, respiratory rate, and oxygen saturation. Pain, a subjective symptom, is often called another vital sign. Measurement of vital signs provides data to determine a patient's usual state of health, or baseline data. Many factors such as the temperature of the environment, the patient's physical exertion, and the effect of illness cause vital signs to change, sometimes outside an acceptable range.
Prepare all supplies needed.
The paraphernalia needed in assessing the vital signs includes watch, thermometer, stethoscope, sphygmomanometer, and we also need to have our alcohol and our wipe cloth. In any procedure, it is important to give our clients privacy and comfort, so we need to close the curtains and also the door if possible. Before starting the procedure, perform hand hygiene. It is important to prevent transfer of microorganisms. Good morning, ma'am. It's nice to see you here. I am Colleen Joy Napatal, your student nurse for today. Now, I am going to assess your vital signs, which includes your temperature, pulse rate, respiratory rate, blood pressure, and pain as our fifth vital sign. Would it be okay with you, ma'am? But before I proceed, may I know your name, ma'am?
I am Jezabel Satumbaga.
Can you state your birthday, ma'am, please?
August 2, 2002.
Alright, thank you, ma'am, for answering my questions. So today, ma'am, I am going to assess the fifth vital sign, which is the pain. So what are you feeling today, ma'am? Do you feel any pain? From the scale of 0 to 10, 0 for having no pain and 10 for having severe pain. What is your pain scale?
0.
That's good to know, ma'am, that you're having no pain at all. Now, I will be assessing your body temperature using this digital thermometer on your axillary site. First, I need to disinfect this thermometer before using it. We're now going to prepare this thermometer by taking it out of its case. Before using the thermometer, disinfect it from the bulb to the stem. After preparing for the thermometer, ask the patient to raise her arm away from torso. Inspect for skin lesions or excessive perspiration. Do not use auxilia if skin lesions are present because local temperature may be altered or area may be painful to touch. So, ma'am, can you raise your arm, please? There are no any lesions present, so we're just going to pat dry the axillary site. Now we're going to insert the thermometer into the patient's axillary site. Please raise your arm, ma'am. So now, we will wait for a minute until the thermometer beat, which indicates that the temperature is already obtained. So, the thermometer already sounded, which indicates that we already obtained the body temperature. Remove it and record the readings. Your body temperature, ma'am, is 36.2 degrees Celsius, which is actually normal. Disinfect the thermometer from the stem to the bulb and return it to its case. Next is we're going to assess your pulse rate using radial sight. We're going to use our watch and our two fingers, which are the index finger and the middle finger. Do not use your thumb because there's actually a pulse in it. First, perform hand hygiene. This is to prevent the transfer of microorganisms. Bend patient's elbow 90 degrees and support lower arm on chair on the table. We're going to place the tips of our index and middle fingers over the radial or thumb side of patient's inner wrist. Slightly extend or flex wrist with palm down until you note strong pulse. And we're going to wait for 1 minute. Your pulse rate, ma'am, is 82 beats per minute, which is in the normal range for adolescents. The strength is normal or expected, which is given a score of 2. And now I am going to note the results. Continue holding the patient's radial pulse, but this time, I am going to assess her respiratory rate by observing the patient's upper chest. We'll do it for 1 minute, but since the rhythm is regular, we'll count it for 30 seconds and multiply it by 2. Your respiratory rate, ma'am, is 18 beats per minute, which is actually normal for adolescents. Your depth of respiration is normal, and your rhythm of ventilator is actually regular. Now, I am going to note the results. Now, ma'am, we're going to assess your blood pressure. Blood pressure is a good indicator of cardiovascular health. It reflects the interrelationship of cardiac output, peripheral vascular resistance, blood volume, blood viscosity, and artery elasticity. The equipment needed in assessing blood pressure are stethoscope and sphygmomanometer. But first, we need to perform hand hygiene to prevent transmission of microorganisms. So before we start, I have some questions for you. When was the last time you take your blood pressure?
2 months ago,
What was your blood pressure back then?
110/90.
Did you take any coffee or did you smoke 30 minutes before going here?
No.
That's good to know, ma'am. And now we're ready to assess your blood pressure. With cuff fully deflated, apply bladder of cuff above artery by centering arrows mark on cuff over artery. Position the cuff 2.5 cm above site of pulsation. Use 2 fingers to make sure that it's not too tight or too loose. Position manometer gauge vertically at eye level and no farther than 1 meter away. Place stethoscope earpieces in ears and be sure that sounds are clear. Hold the diaphragm of the stethoscope using index and middle finger to make sure that you're not hearing your own pulse and place it on the brachial artery. Close the valve of pressure bulb clockwise until tight. Quickly inflate cuff above patient's estimated systolic pressure. Slowly release pressure valve and allow needle of manometer gauge to fall at rate of 2 to 3 mm of mercury per second. Note point of manometer when you hear first clear sound and continue to deflate cuff, noting point at which muffled or damped sound appears. Remove cuff from the patient and help her return to comfortable position. So your blood pressure, ma'am, is 106/85, which is actually normal for 18 years old and above. After the procedure, perform hand hygiene. At this time, ma'am, I will summarize all the results of your vital signs. Your pain scale is 0, which is having no pain. Your temperature is 36.2 degrees Celsius, which is normal. For your pulse rate, 82 beats per minute, which is normal or expected, that is graded as 2. For your respiratory rate, 18 beats per minute. The depth of respiration is normal and the rhythm is regular. For your blood pressure, 106/85, and that is also normal. That's all for the results of your vital signs, ma'am. Do you have any questions or clarifications? That's all for today, ma'am. If you have any concerns or if you need assistance, you can call me, okay?